A very warm welcome to you to this session for our two-day conference. We're super excited to have our wonderful expert panel of Fiona, Cathy, Jackie and Simon talking to us about this important area of understanding how we've got to where we've got and how we could get further into the future. So I hope you enjoy this really stimulating session about thinking carefully about where we've come from and where we're going to in intellectual disability healthcare. It's my special pleasure to ask the panel to introduce themselves, starting with Fiona.
Hi, I am Fiona McKenzie, AM. I'm the Vice Chairperson of the Council for Intellectual Disability. And the perspective I bring is a person with lived experience. Sitting on this panel is probably really exciting because I'm a voice for people with a disability and I'm representing people with a disability. And that's what it's all about, representing my people.
Thank you so much, Fiona. Over to you, Jackie.
I'm Jacqueline Small. I'm a paediatrician and clinical lead of the specialist team for intellectual disability in Sydney Local Health District. And I bring the perspective of a clinician and somebody who's been involved in the sector for many years.
Thank you, Jackie. Over to you, Cathy.
My name is Cathy Franklin. I'm a psychiatrist, so I'm a doctor and I see people about mental health problems. I am the director of the Queensland Centre of Excellence in Autism and Intellectual Disability Health. That's a big name. But I bring the perspective of someone who has been a doctor working in the clinic, helping people for many years now. And I'm also a researcher and I lead a team up in Brisbane.
Over to you, Simon.
I'm Simon Cotterell. I'm a senior advocate at the Council for Intellectual Disability. And for the last 34 years, I worked in the Commonwealth Government. So I bring a government perspective to this panel. So for the last 4 years of my government career, I worked in primary care and led the work on intellectual disability health. Thanks.
Thank you, Simon. And as you know, I'm Julian Trollor, the Director of the National Centre of Excellence in Intellectual Disability Health, bringing the perspective of a researcher and clinician who's worked in that space broadly as I chair this panel. So thanks once again for your participation. I'd like to first understand what your role has been and what you think the main big developments you've witnessed have been. And so to understand that, firstly, could I hear, Fiona, about you in your role? What do you think have been the major big developments? Which ones have you been part of? And how have you witnessed some of those changes occurring?
So putting things into perspective is really important for me because I'm the one with the lived experience. Yes, I do have an intellectual disability and I'm proud of it because it means I can help other people in their journey and also help myself on my own journey where I've headed and where I've been. I guess in my parents' generation, well, going back to the 1930s, 40s, it wasn't really, disability wasn't discussed. In that era, right up until I went to school, I was treated like everybody else. Disability wasn't discussed probably up until like 20 years ago. So I guess having the centre now to like back then, the centre wouldn't really have worked because disability wasn't talked about. Health wasn't really talked about for people with a disability. We weren't given the opportunity to take part in something like this, which was around back then. Now we're front and centre. Things have progressed, but I know things can get a lot better. If you had asked me to do something like this, say 10 years ago, I'd have said no. But now it's like I've got the confidence to talk. I've got the confidence to speak up, help people, help health professionals, learn how to communicate and use a positive directive while talking to people with disability. Inclusiveness includes them in every step of the way. The Centre of Excellence is probably a guiding light to people with transitioning to people with intellectual disability, so we can help medical clinicians, GPs, doctors, whatever, step into our world, so we can function humanely. I've got the story, and I've also got the lived experience now that you don't have. Now it is our time to shine, and we can help you on that journey.
Thank you, Fiona. And I know you've been so passionate about bringing that experience into your advocacy work, and we might come back to that a little later. Could I hear next from Cathy? Particularly, Cathy, what are the big developments that you've been part of or that you've witnessed, particularly in that mental health space over the last few years?
So I've been working in this space for a long time, so I'm glad you narrowed it down. In the mental health space, we've been advocating for better services and better health for people with intellectual disability for a long time. Most recently, we in Queensland, a number of us made submissions to the Queensland Parliament Mental Health Select Committee, and they made a recommendation that there should be a Queensland Centre of Excellence in Intellectual and Developmental Disability Mental Health established in Queensland, which is a very exciting finding. The government accepted that, and they're moving forward with plans to really expand services in this space, but particularly to build capacity in the healthcare sector, which is very exciting because at the moment it's really hard for people with intellectual disability to get the same access to services that people who don't have intellectual disability have in Queensland.
Thanks, Cathy. Perhaps I could throw next to you, Jackie. You have had numerous hats and you've been able to see this issue and the developments from a perspective of children and younger persons' healthcare, right through to much more highly strategic positions that you've held. What are some of the key big developments that you've been part of or that you've witnessed over the recent past?
Julian, I've been working with children and adolescents with intellectual and developmental disabilities for over 25 years, and I really enjoy this work, trying to help answer parents' questions and help the child develop and grow and learn in the best way they can. I've seen quite a lot of changes over the years I've been working in this field, which has been really encouraging. And I've had a number of roles, including in my medical college as president, and that's enabled me to connect with adult physicians across the country. In New South Wales, I've worked in one of the teams, or the team that was established in the 1960s, probably the first team in the state at Grosvenor Hospital. So I think there's a proud history in New South Wales going back decades. But since I've been involved as a paediatrician, what I've seen is a coming together of professionals and increasingly people with lived experience, and more recently government, to drive some changes. And there are some changes that happened in the early 2000s when, for example, in 2005, the diagnosis and assessment teams moved back to health. And that, I think, was part of some of the earliest changes I saw in New South Wales. And I think since then, there's been quite a fast change with some very big initiatives more recently, like the Disability Royal Commission, like the roadmap that was commenced in 2019. Those big changes nationally and some big changes in New South Wales are really exciting opportunities to make the health services better for people with intellectual disability.
Thanks, Jackie. And that's a perfect segue, of course, to Simon, who's overseen a number of really important initiatives at that Australian Government Department of Health and Aged Care level. Simon, what are some of the big developments that you've been part of, and how has that occurred within your patch?
Thanks, Julian. So I was lucky enough to chair the roundtable process that developed the national roadmap for improving the health of people with intellectual disability from August of 2019 to July of 2021. We got a bit interrupted by the pandemic, but that roadmap process has seen the Commonwealth Department of Health for the first time in a long time engaging in intellectual disability health issues. It saw the Commonwealth Government invest in the Primary Care Enhancement Program with the primary health networks, working with general practice and allied health and others to try to improve the experience of people with intellectual disability in primary care. In the curriculum development framework, which is trying to get intellectual disability health content into university teaching for doctors and nurses and allied health and dentists, and making sure that everyone is aware of how best to help people with intellectual disability in healthcare. To support the take-up of annual health assessments, there's some work going on to engage those health assessments in general practice software and to promote their uptake. And also we've seen the funding of the National Centre of Excellence to just continue this work and to continue pressure to improve how health services address the needs of people with intellectual disability. A couple quick more things. So for the first time, we have actually engaged with people with intellectual disability, their families, support workers and others in developing this policy. And we've really seen the Commonwealth Department of Health and others start to produce easy read information routinely. So I think those are important developments.
Isn't it wonderful that there is so much to add to that conversation? Each of you have highlighted really significant changes, initiatives that you've been part of or that you've witnessed over a relatively short space of time. The sense that I have is that momentum is building in this area. One of the things I think you touched on, Simon, is how we include people with intellectual disability and families. And I want to just ask Fiona, with all this change and these developments, do you think there are some major changes in the way that we're including people with lived experience compared to, say, earlier?
I've seen the changes, but I think people with intellectual disability are saying, well, we're capable of making major decisions about our life, but also we can have major input. So instead of medical professions and clinicians, they can come straight to us and not straight to our parents or our advocates or our nominees. We know what we need, what we're capable of vocalising. Even though I do have a disability, I can make my own decisions, but I might need that bit of prompting. But then again, who doesn't need that bit of prompting when we get a bit tongue-tied, a bit stuck? So give us the opportunity to have a conversation or start a conversation with you, and you'll understand my needs and wants, and that's not somebody else's.
Thank you, Fiona. It's been clear to me that advocacy by people with intellectual disability has been one of the most powerful things in making change happen. I wanted to ask other panel members whether there were things that they had thought had really helped change and move things forward. Perhaps if I could start with Jackie and move next then to Cathy in the mental health space, and then Simon in that strategic Department of Health and other hats he's been wearing. So Jackie, are there some things that you think have really helped accelerate change?
Julian, I would agree with you that involving people with lived experience has been crucial. I also think that shows to other people the type of health services we want to see accessed by people with intellectual disability, which is inclusive. So we have to show them what we want our health services to look like. So I agree that that's been a source of very rapid change. I suspect change is often based on a long tail, and I do want to acknowledge some of that tail in New South Wales, because there were some very senior, very experienced and dedicated clinicians when I started working in this space who really wanted to see things change. I think once the health system started to accept it was its business, and some really powerful data, Julian, that you were part of developing, that showed the extent of the difference in health outcomes, and the stories effectively told by people like Fiona, I think it became far more persuasive that the time for change was now. It couldn't just wait for the future. We know other groups of people also experience poorer health, but I think the data shows just how disadvantaged people with intellectual disability are and how poorly the health services are in bringing about that change. I think the Disability Royal Commission was a chance to really shine a light on not just the health system, but other services. And that got a lot of people talking about the importance of change. And again, people with lived experience were key parts of that process.
Absolutely, that's really helpful. And we'll come back to that long tail of development and try and unpick why things took so long to really build to action in a moment. In the meanwhile, Cathy, what are your reflections on the key drivers of change, particularly in the mental health space?
I think, like Jackie has said, that that there's multiple things coming together. I do think that that the voice of people with intellectual disability and their families and support people has been very powerful, particularly in communicating the need to bodies like the government and helping them understand. And I think that at least in our experience in Queensland, that's been a very powerful voice, and that's been very important in making these things happen. I think also as a doctor and someone leading a service and someone really pushing for change, the other things that we've really needed have been things like data and research to back up what people and their families and their support people are saying. That's been really helpful as well. And I think the last thing has been being able to demonstrate that we can help this change happen. I think those things have been really powerful in getting these things happening.
Thank you. And I think you highlighted the importance and centrality of the voice of people with intellectual disability and families. And we must remember that this change is occurring in the context of a broader societal attitude shift toward people with disability and a broader, I think, valuing of inputs and the voice of those with lived experience. So I think it's fortunate, really, then that we have had experts in advocacy raised up people with intellectual disability and their family members in advocacy to add their voice. So we'll go to Simon now. Simon, really, what do you think are the ingredients that have been accelerants in this change?
Yeah, so I agree with everyone that the advocacy has been really vital, and having people with intellectual disability advocate for themselves has been so important. Fiona's voice is a very clear and strong voice, and you know, supported by people like Jim Simpson, but also by the researchers like you, Julian, and by the clinicians like Jackie and Cathy. Just so important to have everyone speaking behind the same set of priorities that are led by people with intellectual disability. I think we've been I agree with Cathy that and Jackie that the data and the evidence is so important. The evidence about life expectancy, about avoidable deaths, about potentially preventable hospitalisations, has just been so compelling for ministers. I think we've been lucky to have supportive ministers in the Commonwealth, so health ministers who are willing to listen, and under the previous government, Minister Hunt, but under this government, Minister Butler and Assistant Minister Carney, just been really engaged and willing to engage with this issue, because, you know, the easiest thing is to do nothing and say it's someone else's problem, and they haven't done that. I think that gives us all hope. And I think we've had great engagement from the state governments as well. So when the Commonwealth has wanted to do something about this issue, state and territory governments have been really willing to engage on it. So I think we've had, you know, we've really hit some good times ahead of the pandemic, and they've continued. So that's terrific.
And so we might come. Oh, sorry, Fiona, you go.
Just before we move on, I can actually give you a pretty alarming statistic that shouldn't even be happening these days. So that people with intellectual disability die between 26 to 28 years younger than a normal population because we are misdiagnosed, we're not listened to. I can see that it's starting to change all across sectors, especially in intellectual disability health, but we're actually being listened to. That's a high statistic, and it needs to come right down. It is too high.
Absolutely. And it's really clear that you've used that very effectively in advocacy. I was just wondering, Simon, from your perspective, has there been a way that government departments have changed in the way they're functioning, or the way they approach areas that haven't been singled out for special attention in the past? Is there a difference in the way government is approaching those areas?
Gosh, that's a tough question. So I'm not, look, I'm not sure. I think, you know, there are lots of well-meaning bureaucrats out there who want to listen and help people in the community. The difficulty always is, you know, money, finding budgets to do these things. And I think the intellectual disability sector has been really smart about finding some small things to do and building on them over time. So, you know, I think that kind of approach has helped, you know, and I think the pandemic helped us because we were all a bit more willing to listen and talk and do whatever needed to be done to protect people's health. So I think it really helped open some doors in intellectual disability health.
So you raise a really interesting point, I think, about strategy and about the approach that has been used in advocacy, presenting information, consistency of that strategy, specificity of asks, incremental asks over time, that I think have been really important. And having the formula worked out, one that works well, having advocacy initiatives led by people with intellectual disability, having them paired with strong, very savvy advocacy and senior advocates who are powerful in their role, and having that also paired with clinicians and researchers to provide other input and other sources of information that confirm the statements by people with lived experience. All of those things come together perhaps in a very strategic way at a time when government and perhaps ministers are more willing to listen because of a shift in attitudes and approaches to those living with disability. So these are some of the things that sound like they have helped, as well as as Jackie said, the long tail, the long history of developments both in capacity of advocates, research, clinicians lobbying and advocating for change in lots of different places at lots of different levels of the services system. So if we think a little bit now about some of the difficulties or the barriers to some of those changes, because thinking about those problems is going to help us know how to tackle them when they come in the future. We're not pretending that things are radically different yet. We anticipate further blockages. What are some of the things that have got in the way of some of the changes? And what do we need to do? What will be some solutions to them? And I'll just open this up for general conversation at this point. Who would like to go first?
Julian, I'm happy to make an initial comment,
Thank you.
or a couple of initial comments, perhaps. The first thing I think, as I'm looking back on this long tail, is that in New South Wales, we were a small number of individuals interested in doing a better job for people with intellectual disability and in our health system. We were a small number of individuals. So I think unless we come together and stay connected, we won't have that same powerful impact for force and be able to leverage and work together with other people. So I do think increasing the numbers of people who are interested in this space, finding other organisations and other individuals who might not have identified as having expertise or interest in intellectual disability is really important. And I think that's something we probably didn't do in the past. For example, I know my adult physician colleagues, my general physician colleagues are very interested in doing a good job for people with intellectual disability, but wouldn't identify as an expert in intellectual disability. And I've also seen recently some new organisations take some responsibility, like the Australian Health Commission for Quality and Safety in Healthcare. And I think those are sort of things that will help drive. And I think the earlier days when we weren't as connected and didn't identify potential stakeholders, I think slowed us down and was discouraging, to be honest. It was hard work in those days.
They're really interesting observations, Jackie, and that cohesiveness and the collectiveness, the sharing of that mission, both I think within health professionals groups, but also a broader interconnectedness with others who do excellent work across different sectors is really important. I'm just wondering if I could ask you for your opinion on the issue of the demedicalisation of disability that occurred some time ago, and with the important steps of deinstitutionalisation, whether in fact, as really the medical inputs disappeared from disability support, do you think that had a role in perhaps stagnating or slowing things down?
Julian, I think that resulted in a shift of responsibility for the healthcare of people with intellectual disability to a sector that didn't have primarily have responsibility for healthcare. And while I know many of those doctors worked very hard and genuinely, I think it was a system that was disconnected and ultimately petered out. But the 2005 move of the diagnosis and assessment teams was a return to the health service of the remnants of those services. And I do think that coincided with an early stage of raising awareness in New South Wales of the importance of the health of people with intellectual disability. I do think, though, in New South Wales, in the past, the Disability Department played a crucial role in pointing out to health and working with health how to improve the health of people with intellectual disability. So I saw that there was a leadership about the importance of healthcare needs and working with the disability sector prior to the NDIS that I thought was very important for people with intellectual disability.
Thank you. So we see this kind of where does this belong idea occurring in a range of different areas. We see it occurring in research, where research related to people with intellectual or other disabilities is undervalued by the medical community. We see it playing out in who's responsible at a government department level and who does healthcare. And really, this is a shared responsibility. We see it as we think about capacity building in our workforce. Whose responsibility is it to drive those capacity building initiatives? And of course, in services development, whose responsibility is it? Who should fund services that essentially require multidisciplinary and cross-sector input? So I'm just wondering if anyone, particularly perhaps I'm interested in the perspective of the mental health sphere, Cathy, whether you could comment from a mental health perspective, has this been something that's really slowed us down? And what could be some of the ways we could solve this problem or progress it differently?
Well, you like the challenging questions, Julian, and I don't know if I'll be controversial or if I'm just going to make people roll their eyes, but I think this is a massive thing. And we see this every day, and in health services just saying, no, we don't see it. We got a letter last week or the week before from a health service in Queensland, a state-funded health service that said, addressed to the patient, thank you for coming to our mental health service. We don't see people with intellectual disability or autism in our health services. We suggest you find help elsewhere, with the government logo on it and signed official letter. And that's this year. And I think a lot of that stems, and I think when I'm talking with leaders of health services and things, a lot of them just don't believe that. And they say, people with intellectual disability don't belong in our service. I had that a few weeks ago. And so I think a lot of this does trace back to that whole separation. And I don't exactly know what the answer is, but I do think that sometimes I try to think up explanations for why this might be. Some of these things are unexplainable because I think in this day and age, I lose words sometimes when things like that happen, because we've got the data, everybody knows, and so I think that's the importance, and I think things like that show the importance of having the top down and the bottom up approach. I think we do need, and I think that we will benefit from the federal government having a strong position on what people with intellectual disability health rights are in the health system. I do think that health services should be held to account because this shouldn't still be happening. Because I actually feel sometimes that attitudes within healthcare systems are worse than in the general community. I think the general community is a lot more on board with these things than health services sometimes. So it does drive me a little bit crazy. And a lot of that is attitudinal change, but I think that division those years ago just has given permission to make such astounding statements as the ones I said. So I think somehow there has to be an agreement, and there has to be a coming together. Because I've also observed over the years that some of the initiatives before NDIS and quite possibly since NDIS from the disability sector have been to try and improve health services out of necessity, I think.
Yeah, I'm just, can I jump in on that, Cathy?
Yeah.
I'm just horrified by that story. Just
Sorry,
because
maybe I should have come with a warning. But
Fiona is too, yeah. So these arbitrary silos, you know, that governments need to organise themselves in some way, but we can't let them be used as an excuse not to see people and support their rights. So, you know, health services should not be turning anyone away. And equally, disability services should be also supporting the health of people with intellectual disability. We can't, it's not a kind of, it's not a divisible thing. The health part of a person is not separate from the rest of the person's support needs, you know. So I really think we cannot let silos get in the way of collective and shared responsibility. And I think Fiona's voice is needed on this issue because she's one person.
So Fiona, could I ask you, I'm hearing stories like that, the bias still occurring, people not being able to access the services that they need. What do you think the approach should be with advocacy in situations like that? How could we advocate to get that fixed?
So the approach for advocacy would be make it positive. Don't judge. Don't put us in like one box, because everybody's different. We're not. So we might have a disability, but not everybody's disability is the same. So advocacy for people with a disability in the medical profession or wherever you are, it's like, listen to us. Don't talk to our nominees, our advocates, or whoever, it's us. We're the ones with the stories. We're the ones who have the information. I mean, don't label us. Like, labels are for clothing, not for people, as a very wise person once told me. I mean, if you are in our situation, how would you like us to categorise, put you in a box, categorise you, put you to one side and talk for you? Would you like it? I don't think so. We don't like it. We have a voice. We're the ones who are advocating for us. We're not advocating for you. We're advocating for us. Let us talk. Let us give us the information that we need to give you.
That's all about not making assumptions about people.
Exactly. People make assumptions from what they see, but not what they've heard. I mean, it's not fair. We don't make assumptions about you, so don't make assumptions about us.
That's really important advice. So we want to move on to think about big recommendations that the panel might have for people listening or for the work of the centre about big changes that are needed and how to make them happen. Perhaps, Fiona, you've got the floor. What are the big changes you think others should try and make happen?
I've been thinking about this quite a lot. And I think respect is probably one of the biggest key changes I've seen. Respect you, but do you respect me? It goes both ways. You need to respect my space, my story, my health problems. I respect you. Are you going to respect me? Respect goes both ways.
Excellent. So we need to build the awareness of people working in health and other health-related disciplines to make sure that they are able to show that respect and include people with intellectual disability. That's, I think, a really major goal.
Let us take the lead. Let us be the front runners. And you will learn a lot from us. And we will learn a lot from you. It goes both ways.
Indeed. Have you any other big recommendations?
Respect. And most importantly, listen.
might go then to Cathy and then Jackie and then Simon in that order for big recommendations for either the stakeholders listening to the conversation or for this work of the centre.
Well, I guess my big recommendation, and I think back to when I started working in this area and sitting in meetings and things, I think my big recommendation would be to be involved and not to feel like those important people will make it all happen. Because I think it's really important, even though we've got some spokespeople, that we hear and people are engaged and people are involved and they tell us about what's important. And that's really easy to say in this day and age when there are lots and lots of emails and everybody's very busy. But it's really easy to think, oh, someone else will take care of that. But I would really just encourage everybody to take the time to be involved and to look at the best way of working together to get a louder voice, so that we can continue to push for change together, I think.
Thank you. And one of the big advantages of doing that and doing it well for people with intellectual disability is, particularly in mental health services, you then allow improved access for many people experiencing cognitive difficulties within that setting. So there are benefits well beyond people with intellectual disability across every aspect of the health service system, but particularly I think in mental health. Could I ask Jackie for your big recommendations for the work that needs to be done, either in the stakeholders who may be listening or for the centre?
Julian, I think we have a plan already mapped out in the National Roadmap for improving the health of people with intellectual disability, and that's very detailed, so I think people should read that. So my recommendations, a bit like Cathy, are about how we do that. I think that, as you're alluding to, wider changes in the health system that may also benefit people with intellectual disability, although you spoke of it in the reverse, is something we should engage with. For example, the Integrated Care Initiative, to look to see how people with intellectual disability can be engaged in that. I also suggest to keep dreaming big. I think there's been a number of people who have dreamed big, and I think we need to keep doing that because there's still a lot we need to do. I think we need to actively engage with the health agencies who are already involved, but find others who can help drive change and make changes happen, and other individuals who are really committed to doing a better job in the health system. I also think that the road is a long road still ahead, even though we've achieved a lot in the last 5 years, particularly with the new Centre of Excellence and with the National Roadmap and the funding that New South Wales Health has provided. But I do think, given it's still a long journey, we need to keep celebrating our successes and keep people engaged for the long term. We need to be committed to the changes. We need to help drive the changes, and we need to keep on the path that we've set to improve the health of people with intellectual disability.
Thanks, Jackie. And implicit in what you're saying, I think, is that for the sorts of changes and strategy, we require multiple different inputs. We require lots of different types of experts to come together to help us plan and do this well. I'm really aware that we have been quite a small group of people, both advocates, people with lived experience, health professionals and researchers working together really well. But actually, to accelerate the change, we need many more inputs from people who know about how health services reform works well, how innovation in healthcare works well, the best way to experiment and evaluate with new models of service and ways of thinking, people who work in areas related to health economics and health funding, and people who work in the policy arena. There's so many different inputs and rich inputs that we need. But I really like the message that we need to aim big. And there are many people listening to the conversation who can certainly aim to do something, to start something or to accelerate their efforts in their patch, remembering that our audience is a really diverse mix from lots of different sectors. So I wonder if I could go lastly to Simon. Simon, what are your big recommendations for stakeholders of the centre? So
for the centre, in particular, I'm focused on the word excellence. So I would really like the centre, and building on what Jackie said, to keep pressing ahead on best practice. We've got to find what best practice is happening and scale it up across the system. We've got to continue to develop better ways of helping people with intellectual disability. We've got to share all of the learnings right to everyone who needs to understand them, and we've got to behave ourselves in a best practice way by, as Cathy said, collaborating across all of our partners and with governments and with people with intellectual disability. So I want us to keep pressing for the best.
Excellent. So we've had a wonderful conversation today about where we've come from, the very long history of efforts of many people, clinicians, researchers, advocates over such a long time, how we've seen some acceleration of that over recent years, and in particular, the influence of leading initiatives such as the development of the National Roadmap, only achievable through extensive advocacy and commitment by government. And then we've talked over how to troubleshoot when the going is difficult, when there are roadblocks or difficulties. We've also talked about the major work to be done. There's so much more that needs to happen in the intellectual disability health space to address the systemic neglect in healthcare and to address the ongoing needs of people with intellectual disability. What a rich conversation. We're really excited that you've all been able to join us on the panel for this conversation, and we will really appreciate, I think, through the rest of the conference, just thinking about how this panel session has really informed our thinking and helped us really get into the right groove for the rest of the conference. So thank you so much for your participation, and we really look forward to you being part of the rest of the conference. So we've heard some wonderful suggestions today, Fiona, and I think it's important we finish with the final word from you.
My final word would be, we call the government, both state and federal, to work as a collective, to work with people with intellectual disability and the Centre of Excellence, to give people with intellectual disability the right healthcare they need so we can live our best lives now and in the future. So come on, government, work with us so that we can improve the lives of people with intellectual disability.
Thanks, Fiona. So much work that has to happen, so many things that needs to be done, everyone's responsibility, and let's all work together. Really appreciate having you on the panel.
Thank you.